Ahead and get started. We just have a couple intro slides, so if folks kind of trickle in, that's no problem. So good morning, everyone, and welcome. Thanks for being here this morning. My name is Abby Tynan. I use she, her pronouns, and I am the Associate Director of Communication for CSU Health Network, and we are every student's on-campus home for health and well-being at CSU. Today, I'm going to be going over the services provided for you at the CSU Health Network, and we're also going to be reviewing the new student requirements and recommendations. And so as previously mentioned, please use the Q&A function. I will save all the questions until the end of the presentation, and then I'm happy to go through all of them. And of course, I can use the chat to provide any follow-up links as necessary. All the information covered in this presentation is on our website, health.colostate.edu. I will put that in the chat right now. So again, that's a great resource for you as the semester kind of approaches. And of course, at any point throughout the semester or your time at CSU, it's just a great resource for you. So let's go ahead and get started. So first, just a little bit about the CSU Health Network. If there's one thing that you can take away with you from this presentation, it's that you have access to all of our services regardless of your insurance plan. And we are truly here to support you. Our tagline is care for body and mind. And that's because we don't like to look at students as pieces and parts of themselves, but rather we know that physical health and mental health are so largely intertwined that we like to take that integrated approach to caring for students. And unlike other colleges and universities across the country, we do have integrated medical and mental health services all under one roof. We also know that health and well-being is such a critically important part of your experience as a student here at CSU and just on your path to graduation. And so we feel like we have the services that can really help support you on this journey. We have over 200 providers and staff members that are experienced with and passionate about college healthcare. And in addition, we are also accredited by the AAHC as well as the American Psychological Association. And we always get the question, do you have real doctors or are these students practicing on students? And the answer is yes, we have real doctors. These are board certified providers that go through rigorous accreditation processes, and they truly love working with the college student population. So you are in good hands when you come and see us. Today, I'm going to be going over these service areas here. So we'll talk about our medical services, our mental health services, and then of course, our health education and prevention services. Before we dive into those, I just want to note, kind of show a picture of our facility and talk exactly about how you can reach us. So this picture on screen is it shows the CSU Health and Medical Center, and the CSU Health Network is located on the second and third floor, and we take up about half to 2/3 of the first floor. And so if you are ever interested in coming and seeing us, again, we're located on the corner of College and Prospect, so one of those far corners on campus. And there are a couple different ways that you can access us, and I'll point those out on the map first. So for students who are living on campus in student housing, you can utilize the Around the Horn stop. Around the Horn is a campus busing system that has different stops across campus, and one of those is outside of our facility, right near the train tracks. And so that could be a great option to reach our facility. Of course, you can always walk, bike, longboard. In addition, we have a patient and client parking lot. So if you do have a vehicle during your time at CSU, you can park in our parking lot for free during the duration of your visit. And I believe we are only one of the free lots on campus. So again, you can utilize that just during the time of your visit at the CSU Health Network. And then last, I will point out the MAX stop. So the MAX is a Fort Collins busing system that runs parallel to College Avenue, which is one of our main roads in Fort Collins. And CSU students can ride the MAX bus for free using their CSU ID or RAM card. And so depending upon where you're at on campus or maybe where you live in the community, this could be a really great option to also reach the CSU Health Network. So now let's talk a little bit about our medical services. So our medical services are broken into kind of two main areas here. We have our general medical services and then our specialty medical services. Within our general medical services, we have our primary care. So you can think about that just as your regular doctor's office. You need a checkup and you want to come and meet with someone, that is accessed through our primary care. We also have a pharmacy on our first floor. So if at any point you're needing prescription medications, or even if you need to pick up some over-the-counter medications, you can do so right on campus at the CSU Health Network Pharmacy. We also have an immunizations clinic on our second floor. So whether you need to receive your new student vaccinations, or maybe you need your flu shot, for example, or even an updated COVID vaccination, we can give those right on campus. Then wrapping up our general medical services, we also have laboratory, radiology, and behavioral health. But our specialty medical services really set us apart from other college and university healthcare settings. We have a lot of services that folks may not think that we would have. For example, we have a dentist, so you can get your teeth cleaned right on campus. We also have an optometrist, so you can have your annual eye exam. And if you wear contacts, you can even get your contacts picked up directly from us. We also have physical therapy, sexual and reproductive care, LGBTQ plus inclusive care, and much more under our specialty medical service area. Anytime a student is interested in accessing our medical services, you will always want to bring with you your CSU ID or your RAM card, as well as your insurance card. And we're going to talk a little bit more about exactly how health insurance works at the CSU Health Network a little later on in this presentation. Next, we'll dig into our mental health services. So we are very proud of the culture of help seeking that has been embraced by CSU. This is all the way from the president's office to faculty, staff, and students. And so a small portion of your student fees helps pay for a wide range of these mental health support resources. This includes our crisis services, our groups, our workshops, brief individual therapy, and more. Speaking of our brief individual therapy, as well as our groups and workshops, we have one of the largest groups and workshops programs among colleges and universities in the country, with just shy of 50 groups and workshops each semester. So if you're interested in accessing our mental health services, you can come and visit us on the third floor of the CSU Health and Medical Center, and one of our licensed professionals will meet with you to work closely to determine the services that are best for you, given your goals, your preferences, your identities, and your areas of concern. So this talks a little bit more about accessing mental health services. So these are broken up into kind of two buckets. So we have services where no screening or referral is required. So you can access these at any time. These include our multicultural counseling services, our skill building workshops, and then our online 24/7 tools. And then we do have services where a screening or referral is required. And this is where you would go through that process of coming in to meet us on the third floor, meet with one of our counselors, again, talk through your goals, identities, areas of concern, and we will set you up with services that are best fit for your needs. So for some students, that might be brief individual counseling. Others, it may be therapy groups, psychiatric services, or others. So the main takeaway here is if you would like to access mental health services, please just come and see us and we'll set you up with the best services possible for your needs. I also want to note that we do not offer advanced appointments for our mental health services. So again, that first step to getting integrated with our care is to come and see us. Okay. Now we'll move on to our health education and prevention services. So within HEPS, we're very proud of the robust skill building programs and services that are offered. This includes, we have resiliency and well-being, we have our mental health and well-being folks. We also have peer education called CRUIS. So if you've heard Rams Take Care, Rams Take Action, that comes directly from our peer education team, CRUIS. And they do a lot of really great work around bystander behavior, what it means to look out for your fellow Rams, and how to spot a student in distress. We also have stress reduction, support to quit smoking, as I mentioned, some mindfulness, meditation. We also have substance misuse prevention, and then education around sexual health. So now, why does CSU Health Network exist? We are here just to help you with your medical and mental health needs so that you can succeed during your time at CSU and even beyond. We want to help you get healthy, stay healthy, adjust to this new environment, and then we can even help you with some problem solving. So how to access us? There are 3 different ways that you can access specifically our medical services. So students are definitely encouraged to make an appointment whenever possible. And there are 2 ways that you can do this. 1, you can call our facility, or 2, you can also make an appointment online on our CSU Student Health Portal. If you're interested in calling to make an appointment, that number is listed on screen, 970-491-7121. And again, you can schedule an appointment online through the CSU Student Health Portal, and I'll actually show you how to access that here in a couple slides. But say you wake up one morning and you're just really not feeling well and you need to see a doctor that day, we do offer some walk-in appointments. So you can walk into our office and meet with a provider that day. So again, call, make an appointment online, or walk in for more of those urgent medical needs. And then when can you access us? So the CSU Health Network is open Monday through Friday about 8 a.m. to 5 p.m. And we do have adjusted hours for university breaks and closures. And those closures will always be posted on our website in case you're ever curious. We also offer phone availability and phone support at night and on the weekend for urgent problems. And I'll talk about how to access that here in a couple slides. And what I want to stress is please don't wait to come and see us. Come early when problems are just starting. So again, there's no problem that's too big or too small. We want to come and see you at any point during your time here at CSU. So as I mentioned in the previous slide, CSU Health Network is open Monday through Friday, 8 to 5, and we do have those phone helplines that I just talked about. So of course, if you're not feeling well and if you're needing care, we encourage you to come and see us first when we are open. We are on campus and we do have all of those medical and mental health services that we just discussed. However, when we are closed, here is the information on those phone helplines. So we have two here. We have a 24/7 nurse helpline, and we also have a mental health crisis intervention line. So at any point, if you or someone you know is experiencing a mental health crisis, please call the number on screen and we will connect you with help. In addition, say CSU Health Network is closed and you're really not feeling well and you're trying to decide, do I go seek care in the community or do I come to CSU Health Network or, kind of what are next steps? You can call our 24/7 nurse helpline and speak with one of our on-call nurses, and they will help direct you whether it's appropriate to maybe wait until the morning when CSU Health Network is open and you can access our services, or if maybe there's a more urgent concern and you should seek care in the community. And if that's the case, there is a list of local urgent care and emergency room facilities listed on our website, which is health.colostate.edu. And again, that website has been put into the chat. And again, emergency care here, if there is a life-threatening emergency, we encourage you to call 911. So CSU Health Network does not provide care for actual emergencies. And of course, if there's ever a concern after hours and CSU Health Network is closed and it is a true life-threatening emergency, please call 911. There are two hospitals in Fort Collins, the closest of which that we would recommend and send students to would be the Poudre Valley Hospital. That's the closest to campus. And then in addition, there's also Banner Fort Collins Medical Center. So then how will you pay for the services that we just talked about? So your health insurance is going to help pay for the medical services that you receive at CSU Health Network and even outside of CSU Health Network. And then what you owe really depends on your health insurance plan benefits. And I have a video that I'll show you in a couple slides that talks through what your benefits look like on the CSU Student Health Insurance Plan. And like I mentioned, your counseling fee provides access to all of those mental health support services at no additional cost to you. So your health insurance really only applies when you're accessing our medical services at CSU Health Network and in the community. So now we're going to move on to the new student checklist portion of the presentation. So at this point, you've learned a little bit more about CSU Health Network, the services that we have. We talked about hours of operation, where we're located, and what to do when we are closed. So now we'll talk about our new student checklist. And again, all of this information is on our website, health.colostate.edu. So the first that I'd like to talk about here is submitting immunization records. So CSU Health Network requires that students submit proof of measles, mumps, and rubella vaccinations. And then if you're going to be living in student housing, such as the residence halls, for example, Colorado law also requires students to submit the proof of their meningococcal vaccination given within the last 5 years. So that's kind of the key there. All immunization records are to be submitted through the CSU Student Health Portal, and I'll walk you through how to do that here in a couple slides. We don't accept any paper submissions, and in addition, all your submissions must be translated into English. So please make sure before you submit them that all of your records are in English. You can scan your records or take a picture of them, whatever is easier, and then submit them directly to the CSU Student Health Portal. The deadline to submit your immunization records is the first day of classes, so that's Tuesday, January 16th. If we do not receive your immunization records by the first day of classes, we will put a hold on your student account and you will not be able to register for classes for the following semester until this immunization record has been met. So please make sure that you're submitting these records and reach out to us if you have any questions about these. And again, the deadline to submit is Tuesday, January 16th. Next, we're moving on to completing important health forms. So while these are not required, they are highly recommended. And these are the tuberculosis assessment and the health history form. Both of these forms can be completed by logging into the CSU Student Health Portal. The health history form especially is really important for us because it gives us a complete background on your physical and your mental health before you arrive at CSU. So this just really equips our providers and clinicians to provide you with the best care possible because they have the complete background on your physical and mental health history. So I know it can definitely be a little bit of a longer form, but we just ask that you please take the time to fill this out so we can provide you with the best care possible. And again, both of these forms can be found on the CSU Student Health Portal, and the deadline that we're asking students to complete these by is the first day of classes, Tuesday, January 16th. So as I mentioned, I was going to walk you through how to access the CSU Student Health Portal. So this is a screenshot of our website, health.colostate.edu. And again, that URL is in the chat. And if you notice here, there's a gray quick links panel, and the second button in is the Student Health Portal here. So if you click on that link, it will take you to this page here, which is portal.health.colostate.edu. And here you would log in with your e-name and password. This is the same login that you would use to access RamWeb, for example. And once you log in, you will be taken to this page, which is kind of your homepage for your individual health portal. And so you can access all of the forms that we just talked about, the health history form and the tuberculosis assessment, through the My Forms button here in the main navigation. However, you may also notice that you have a notification that says you have pending forms. So that can kind of be a good way for you to gauge, have I met the requirements or have I not? In addition, you have to submit your immunization records online to the CSU Student Health Portal. And as you can see here, this third arrow points to this document upload button. So whenever you have a scanned picture or even just a picture from your phone of your immunization records, you can click the document upload button on the CSU Student Health Portal and upload your records directly to your individual profile. Okay. At this point, I'm going to switch my screens here that I'm sharing, and I'm going to share a brief video about the overview of the US healthcare system and specifically how your CSU student health insurance plan will work at the CSU Health Network and in the community. So I'm going to stop sharing the screen and start sharing a new screen here momentarily. And then if for some reason there's issues with the audio, if someone can just put that in the chat, please let me know so that way I'm aware. I want to make sure that folks are hearing this.
I'm not hearing anything right now.
Okay. All right, let's try again here. I'm going to disconnect my AirPods real quick. Okay, can you hear me talking okay?
Yes.
I think I'm going to have to go into settings just a moment. Okay, can you hear me talking now?
Yes.
Okay, let's try this video again. Let me know if you can hear it. Oh, I can't even hear it.
Yeah, if it's playing, we can't hear it.
I can't hear it either. Hold on, I'm sorry. I don't know what's going on. troubleshoot this one more time.
As a
Any
CSU
luck?
student, you
Yep.
have access to all
Okay,
of
let
our
me restart it.
services. Welcome to CSU. We are happy you are here. CSU Health Network is your home for health. We provide medical, mental health, and health education and prevention services to students. As a CSU student, you have access to all of our services. We know that accessing healthcare and using health insurance in the United States works differently than in your home country. This video will provide information about using health insurance in the United States and specifically how your CSU Student Health Insurance Plan, also known as SHIP, will work. In the United States, there is no universal health care, and people must purchase their own health plan to help pay for care when medical needs arise. Even so, when you visit a doctor, insurance will usually not cover all the costs. Most of the time, people will pay some amount when receiving health care. Because healthcare in the United States works differently than in other countries, it is important to define some common health insurance terms. A healthcare provider is a licensed medical professional or healthcare organization that provides medical services or treatments to patients. Deductible is a set amount of money you pay each plan year for covered healthcare services that you have received. Your health plan will begin to contribute toward the cost of care after the annual deductible has been met. Once the plan year deductible is met, you will still share in the cost of your medical care. This is when you may hear the terms coinsurance and copay. Coinsurance is a percent of the cost. You and your insurance plan will each pay a percent of the cost of care that you receive for medical services. A copay is the amount that you pay after your deductible has been met for a particular service each time you get that service. Now we'll talk about in network and out of network care. In network means that the health insurance carrier has a financial agreement or contract with a healthcare provider, such as a doctor or facility, such as the CSU Health Network. Out of network means that the provider or facility does not have contract or have a financial agreement with your health plan. Out of pocket maximum is the most you will pay for covered healthcare during a plan year. Once the out of pocket maximum has been met for the plan year, you will not owe anything more for covered healthcare during that plan year. Plan year is a 12-month period of time during which deductibles, coinsurance, and copays accumulate toward the out of pocket maximum. CSU SHIP's plan year is August 1st to July 31st. Out of pocket costs are your expenses for medical care that are not covered by your health plan, including the deductible, coinsurance, copays, or non covered services. For CSU SHIP, international students have a $500 plan year deductible when medical services are received outside of the CSU Health Network with in network providers. There is no deductible to meet when you receive your medical care at the CSU Health Network. When you receive medical care at the CSU Health Network using SHIP, there are no co-insurance or copays, and medical care is covered at 100%. When you use an in-network provider, you will pay a smaller deductible, $500, and coinsurance, 20%. When you use a healthcare provider or facility that is out of network, you will pay a larger deductible, $1,000 instead of $500, and a greater percentage of the cost, 40% instead of 20%. Because healthcare in the US can be costly, it is most cost effective for students on the CSU Student Health Insurance Plan to start their care at CSU Health Network if possible. You can think of CSU Health Network as your on campus doctor's office. When you access medical or mental health care at CSU Health Network using your SHIP insurance, most, if not all, of your care is covered with no out of pocket costs. This is because for students with SHIP, the deductible does not apply for services received at CSU Health Network. CSU Health Network offers a variety of general and specialty medical services, including dental, vision, immunizations, primary care, pharmacy, physical therapy, and more. To learn about all of the services at CSU Health Network, visit health.colostate.edu. Your CSU Student Health Insurance Plan is also in network with many providers and facilities in Colorado and the United States to make it convenient to find care at the lowest cost. When healthcare services are received outside of CSU Health Network, students enrolled in the CSU Student Health Insurance Plan will have a deductible to meet and then either coinsurance or copays depending on the service received. Specific details about what you can expect to pay under the Student Health Insurance Plan can be found at health.colostate.edu/international-ship. As you learned earlier in this video, we encourage you to visit in-network providers whenever possible. If you are looking to find an in-network provider off campus, staff at CSU Health Network or your health plan customer service department can help you. Once enrolled in the Student Health Insurance Plan, you should carry your insurance ID card. It can be downloaded to your phone or computer, and you can find instructions on how to download your insurance card at health.colostate.edu/international-ship under the Quick Links section. You should show your health insurance ID card when receiving healthcare so that the healthcare provider can bill your insurance. The insurance ID card also has the insurance customer service phone number on the back if you have questions about healthcare services or providers outside of CSU Health Network. If CSU Health Network is closed or you have an urgent or emergent need, you should seek care at a local urgent care or emergency room. Be sure to bring your insurance ID card. If CSU Health Network is closed and it is not an emergency, the CSU Student Health Insurance Plan also offers online, no cost medical or mental health appointments 24 hours a day, 7 days a week. More information on accessing online care can be found at health.colostate.edu/international-ship. If you have questions about the CSU Student Health Insurance Plan, please call 970-491-2457 or email chuhn_insurance@colostate.edu. Thank you for watching the video.
Great. Thanks, everyone. I'm going to reshare my screen and get my AirPods reconnected, and then we'll continue. Okay, can everyone hear me?
Yes.
Perfect, thank you. Okay, I know that was a little bit of a long video, so I'm actually going to drop the link to that in chat in case anyone is interested in rewatching that at any point, because I know there's a lot of information that was covered. So that is now in the chat, and we will continue the presentation. Okay, so the next thing that we're going to be discussing here is fulfilling the health insurance requirement. So as that video talked a lot about health insurance, you may have heard that health insurance is required for all CSU students, including all international students. International students are automatically enrolled in the CSU Student Health Insurance Plan, which again was discussed in that video. You will be billed for the cost of the plan after you register for classes. And you also have the option of opting out of the CSU Student Health Insurance Plan through a waiver process if you can show proof of accepted private insurance coverage. If you do have other insurance coverage, again, you can submit this waiver request form. You're asked to submit this as well as a copy of your current insurance policy to the CSU Student Health Insurance Office. The deadline to submit a waiver is Wednesday, January 31st, so it's at the end of this month. Some accepted waivers include most employer group health plans, approved sponsor plans, or any individual plans that meet healthcare reform law. And then non-accepted waivers are those that are short-term plans, such as international student plans, foreign plans, and then individual plans that do not meet healthcare reform law. So if you're interested in submitting a waiver, there is information on our website on the international ship page. And again, you would submit this to our CSU Student Health Insurance Office. Now, a little bit more about our student health insurance plan. Again, this was touched on briefly in the video, but the CSU Student Health Insurance Plan, otherwise known as SHIP, pays all costs for most medical services within the CSU Health Network. It pays 60 to 80% of medical costs at the hospital or medical clinics outside of the health network after you pay a $500 deductible. In addition, the CSU Student Health Insurance Plan also has a dental plan embedded that you can use at the health network as well as with Anthem Dental Complete community providers. So this is a really great option for you to get your teeth cleaned right on campus. And then in addition, the student health insurance plan also provides 250 flex dollars that can be used towards non-covered services at the health network. However, the student health insurance plan does not pay for vision care, elective services, non-medically necessary services, or some of the over-the-counter medications. So again, if you have questions about health insurance at all, I can drop this information in the chat here. You can email csuhn_insurance@colostate.edu, and our insurance providers or professionals are happy to answer any of those questions. Now moving on to our next requirement here, which is talking a little bit about completing online modules. So there are two here that are required for all incoming CSU students, and these are alcohol EDU and sexual assault prevention. So alcohol EDU provides personalized feedback that encourages students to consider their own drinking decisions and those of their peers. And then sexual assault prevention educates students on issues associated with stalking, interpersonal violence, and sexual assault. In addition to these two required modules, there's an optional module called Canvas Financial Wellness. And so Canvas educates students on topics such as understanding student loan debt, using credit cards responsibly, sticking to a budget, and planning for your financial future. And so students will receive an email alerting you that these programs are open for access, and you should have already begun receiving these emails to your colostate.edu email address. We encourage you to not ignore those emails, as the deadline to complete these modules is the first day of classes, Monday, January 16th. If you do not complete their required modules, so alcohol EDU and sexual assault prevention, by the first day of classes, you will have a hold put on your student account and you will not be able to register for classes for the next semester until these modules are complete. And so again, please check your CSU email address. Make sure that you're completing these modules by the deadline. And if you have any questions, of course, please reach out to us. And last, we're going to be talking about creating a You at CSU profile. So You at CSU is our online student success portal that provides confidential, customized feedback to help you meet your goals or address your concerns in 3 areas: succeed, thrive, and matter. And so it's really going to connect you with these personalized on-campus and online resources. So this is a screenshot that you can see of You at CSU. And in this search bar here, say you typed stress. Up would pop a variety of cards related to stress. Some of them may even have a CSU Rams head on them. Those specific cards mean that those resources are at CSU. So for example, it could be connecting you with our Mindfully Managing Stress workshop or even another group or workshop across campus. Content cards that do not have the Rams head may just be a video or an article talking about ways to manage stress. So again, it really is a great way to explore everything that the university has to offer. And we encourage you to log into your You at CSU profile before the semester begins and just start exploring. And you can access this directly through your RAM Web account. So at this point, that wraps up the presentation, and I'll be opening this up for any Q&A that you may have. So please type your questions into the Q&A box, and I'll do my best to answer these. And if there's anything I can't answer, I'm happy to direct them along to any staff within the CSU Health Network. So I hope that you learned a little bit more about the CSU Health Network, our services, where we're located, hours of operation, a little bit about our new student requirements, and then of course, a little bit about how health insurance works too. So thank you everyone so much for your time. Again, we are here for you. And if you have questions, visit health.colostate.edu throughout the semester, and I will be opening the Q&A shortly to see if there's anything that anyone submitted. Okay. One of the questions is, do we have an option to choose a health insurance plan? So as we discussed, international students are automatically enrolled in the student health insurance plan. And if you are interested in waiving out of that plan, you can submit a waiver, which is located on our website. And I will find that link for you here and I'll drop it in the chat. And then if it is an accepted plan, then you are waived from the student health insurance plan. So let me find a link to that waiver for you here, and I will drop that into the chat. And then I will get to the next question. So the first link that I'm going to be dropping into the chat here is just the general landing page for the International Student Health Insurance Plan. So that way you can go on and learn more. And then for students who are interested in submitting a waiver, I will drop that link too. Okay, so hopefully everyone can see those links here. And again, if you have any questions, I had dropped the email address of our insurance office in the chat earlier, the CSUHN_insurance@colostate.edu. Okay. So yeah, so the next question here is, this particular individual is missing one of the doses of the MMR vaccine. So if you remember, that's one of the required vaccinations to be a student at CSU. You can receive those at the CSU Health Network. However, your access to our services doesn't begin until classes start. So if you're missing a dose, I don't want you to worry. Please call us at the beginning of the semester. And as soon as you complete those doses, our system will update and we will automatically remove any holds that may have occurred from you not being compliant at the start of the semester. I don't want you to worry about that. Students are not able to register for classes until about midway through the semester anyway. So even if you temporarily have a hold on your account, you will still have time to be able to get those vaccinations before that hold is even really put into effect. So if you need any of those required vaccinations, please just call us at the beginning of the semester and get an appointment to receive those. I hope that answered your question. Okay. The next one, how will the health insurance plans work for hybrid students? For the person that answered this question, or maybe Bronwyn, you're able to answer, I'm not exactly sure what is meant by the hybrid students, and would love to know more so I can answer your question.
Yeah, same. I'm not really sure.
There's also another question. I believe that this presentation is being recorded. Is that correct?
Yes,
Perfect. And then the question is, will this presentation be shared afterwards?
yes, we will email it out after, and it will also be placed on our orientation page.
Okay, perfect. Thank you. Okay, so we'll give it another second for anyone to drop additional Q&A in. And then, okay, here's the answer to the hybrid students are those who do their first semester online, and after the second semester, they will come to the US. So the health insurance plan, I would encourage any students who are hybrid to email our health insurance office. If you are not in the United States and you are only online, then that requirement doesn't apply to you. It only applies to students who are full-time on campus. Bronwyn, I don't know if you want to add anything, but I would encourage any hybrid students to just email our health insurance office and they can provide more information.
Yep, I think that's perfect, Abby.
Just dropping that in the chat. Okay. Perfect. Okay. Can I use my sponsor's health insurance for CSU Health Network, or does it have to be a health insurance plan to use at the health network? Yeah, so that's a great question. So I will go back here. And so for students who may have a plan through their sponsor, you can submit a waiver request to then use your sponsor's insurance, and assuming that that is an accepted. And then if that's the case, you can use that insurance at the health network. It would work a little bit differently in the sense that the coverage that you receive or what you pay would be based off of that sponsored insurance and not the CSU student health insurance. So you can definitely use private insurance or sponsored insurance at the CSU Health Network. You still have access to all of our services. So you have access to them whether you're on a student health insurance plan or another private plan. It just what you pay for our services may be different. So I hope that answers your question there. Okay. The next question, are ambulance services available on campus and are they covered by the health plan? So if you are in need of an ambulance, for example, and you are already at the health network, we could arrange for an ambulance transport to the local emergency room facility. They are not covered under the health plan in the sense that you will be paying something for that ambulance service, meaning that they're not free. I don't know exactly what that cost is, but there would be a cost incurred if you need to use an ambulance, whether you're being transported from the CSU Health Network or transported from another area in the community to the hospital. Yeah, so the next question, is the dental plan covered in the health insurance? And yes, the dental plan is. So that's what's really unique about the CSU health insurance is that we have a dental plan embedded within for students to access. And so I will put a summary of the dental benefits in the chat right now. So you have the option to access these and you can learn a little bit more about our dental plan. You can utilize our dental plan at the CSU Health Network dentist or even out in the community at Anthem Dental Complete Community Providers. And that is covered by paying the health insurance. It'll be covered differently, of course, if you access the dental services at the CSU Health Network versus in the community. But a document that I just dropped in the chat talks through your in-network and out-of-network benefits for the dental plan. That's a great question. Any other questions that folks may have? I'll give it a couple minutes. In the meantime, I will drop just a few additional links in the chat. So I just again dropped the link to our homepage And then I'm going to be dropping the link to this new student checklist. So that way students on this call can read a little bit more about those requirements and recommendations that we just talked about. Okay. Oh, perfect. Here's a new question. If we are opting for private insurance plans, does it need to be partnered with our college? I'm not entirely certain what this question is asking. I don't believe it has to be partnered specifically with your college. You should be able to just have a private health insurance plan and that works to meet the waiver, and then you would have access to our services. So I don't believe it needs to be partnered with your college, but again, I would encourage you to email the CSUHN_insurance@collegestate.edu email address, and they would be able to answer that question for you and provide some additional information. In addition, for any of you who might already be in Fort Collins or on campus, our CSU Health Insurance office is located on the second floor of the CSU Health and Medical Center. And you're also just welcome to walk in and ask questions in person too, if you are interested to come in and see our facility and just meet with someone in person. Okay, we will give it another minute or so, see if any additional questions pop into the Q&A. Okay. It's not looking like anything's coming. So at this point, we can wrap up. I'm going to put my email address in the chat in case anyone has any follow-up questions. You're more than welcome to reach out to me directly. So again, my name is Abby. And there's my email address for anyone who's interested. So again, thank you all for your time. Welcome to CSU. And again, we encourage you to just come and see us. No problem is too big or too small. So come and chat with us or make an appointment if you need some help. So thank you again so much for your time this morning. And thank you, Bronwyn.
Thank you, Abby.
Have a good day.